Posted by u/arb184. Doctors of Reddit, what is the most gruesome case you've encountered? Or nurse here? This is kind of a long one. I was taking a call one night and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time, I lived in a town that had large populations of young military guys and avid meth users, so late night emergencies were common. Got to the hospital, where a few more details awaited me: pararectal abscess. For the uninitiated, this means that somewhere near the asshole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314 pounds Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically from side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best just to get her to the anesthesiologist so we could knock her off out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though, chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch simply because of high tolerance levels. It should be noted that tonight's surgical team was not exactly wet behind the ears. I've been working in healthcare for several years already, mostly in psych and medical settings. I've watched an 88-year-old man tear a 3-diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-Nazi. I've seen some shit. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done a residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-Army and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed, a little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting 4 drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall, it didn't seem to warrant her repeated cries of "Oh Jesus, kill me now." The surgeon steps up with a scalpel, sinks just the tip in, and at the same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, and the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish gray-brown fluid out onto the floor until, within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't fucking breathe, my lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next. An XNCAAD1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? In all operating rooms, everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same: somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is, everyone knows what it is for, and everyone prays to the gods they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. I sprinted to our central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty fucking box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil, and not replaced a single fucking drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I can find, just so we're even. I darted back into the room with the next best thing I can find, a vial of mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could stand next to his machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that mastisol can give you a mild high from huffing it like this. But in retrospect, that's probably what got us through. By this time, the smell had permeated out of our suite, and down the 40-foot hallway to the front desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh so dirty. I stepped back into the suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy, in blue surgical garb, standing nearly ankle deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagoba, except the swamps had just come out of this woman's ass and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out, the front of his gown a gruesome mixture of brown and red, his eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped her off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that. It's soaked into your skin. It takes 4 or 5 bottles to get clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it, too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together, that was bad. The next morning the entire department still smelled. The housekeepers told me later that it took them nearly an hour to suction up all of the fluid and debris left behind. The suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. I laugh now when I hear recruits to healthcare talk about the worst thing they've seen. You ain't seen shit, kid. TL, doctor, don't shoot 4 drugs into your taint. A 2-year-old boy was brought to the ER after an uncle of his accidentally crushed him between his pickup truck and a fire hydrant at waist level. When he arrived he had an exposed bladder and rectum, protruding and severely displaced pelvic bones, no genitalia, bilateral hip fracture, and a fractured left femur. Both external iliac arteries were severed and the blood loss was massive. Despite the efforts of the whole staff, his body didn't resist and he died 36 hours later. Not a doctor, but my father is a paraplegic with almost no sense of touch anywhere below the waist. One day about a week after he moved into his new apartment, live separately, his wheelchair tipped while he was on the sidewalk. Not too big of a deal, shit happens when you're a paraplegic. He had noticed his left leg was bruised, but since he felt no pain he didn't mind it. A few days later the bruise is just intensifying, so his nurse aide, home attendant, whatever they're called, takes him to the hospital to get it looked at. He broke his leg quite badly in 3 places. The leg is set in cast. Here's the kicker, the doctor in the hospital tells him he may never regain full use of his leg again. Doctor here. A couple of months ago I took care of a homeless man who came in complaining of foot pain. He had noticed a wound on his toe and some swelling had spread throughout the foot, so he put a sock on it. A few hours later some drainage had soaked the sock. So he put a sock on top of that sock. And 2 hours later, another sock. It started leaking more, so he put a plastic bag around those socks, and then his sneaker on top of that. When the leaking continued, there was a hole in the bag and the shoe was saturated. He added another bag. And when that bag started leaking from a hole, he decided it was time to get evaluated. With masks and gowns on, we removed each layer of his onion, somehow resisting the urge to vomit as the smell was overwhelming. When we finally got to removing the last sock, we expo his entirely gangrenous footnotes, "Gis wet gangrene if you'd like," and then his pinky toe fell off, hanging by a thread of tissue. I felt really bad for this guy, and he kept apologizing. He didn't want to come because he was embarrassed that he let things go this long without evaluation. We offered him a mask, which he refused, because it was his mess and if we had to deal with it, in his mind, he should too. Seen a corpsman try and revive a Marine that had been blown in half by an IED or landmine or mortar. He was still alive but not talking or moving, just cold eyes looking around in shock. The poor corpsman was trying everything to keep the man awake and comfortable and with him, but we had this other guy who kept saying, "OMG, he is dead, man. Dead. OMG. Dead. It's over. Dead." Over and over again. He too was in shock from seeing his friend dying, but him saying those things over and over again pissed everyone off and could give away our position. He ended up taking a rifle butt to the face which dislocated his jaw and knocked him out cold, a few teeth as well. The boy on the ground ended up dying of his injuries right there in front of us. The whole situation lasted maybe 2 minutes. Or 3. But when I remember the situation it feels like it may have lasted a few hours. I was an EMT for a bit. It's not gruesome in the traditional sense, but nothing is more unnerving for a patient, I would imagine, than the time we were sure this man was deceased and we were getting ready to bag him and he came to. Is that for me? Well, not anymore. I was a trainee at the time. Another story that is far less funny is there was this kid, probably 16 to 17. He took a shit ton of Tylenol to kill himself. In reality, he had no desire to kill himself. It was a cry for help. He was mad because his parents wouldn't let him see his girlfriend. He kept saying he was sorry, and he didn't know. He thought it would just make him sick and throw up, maybe pass out. He died. A week ago I was in the ICU, I'm an RN, taking care of a patient who had previously been treated for a GI bleed. When I went to turn them, I saw the spreading lake of blood poop, technical term, pee. They were bleeding out from some esophageal varies. Ended up shitting out almost 8 liters of blood, and received 25 units over 12 hours. Back in nursing school, I took care of a guy who had tried to commit suicide via the shotgun to the face method. Managed to blow off their entire face, but missed all the parts that would cause them to die. That is the worst kind of misery. My dad is a surgeon and I asked him this question a few weeks ago, and he said that the most disturbing thing he saw was a young boy who was brought to the ER who had his skull crushed when he was standing underneath a falling tree his grandfather was cutting down. My dad said his head looked bruised, mushy, a deflated balloon that just barely held the shape of what was once a skull. His mother was in hysterics, holding him in her R&MS begging doctors to do something. According to him, nurses inserted IVs and whatnot to appease the mother, but some of them had to turn away or leave the room to puke because of how grotesque the boy looked. My dad had to ultimately step in and say that there was nothing they could do, the boy was dead. British doc here. This was 6 months after graduating from med school, working in the intensive care unit as the intern/houseman. Though I am now only a few years into my working life, I suspect this may be the most harrowing situation I may ever see in my professional career. At least I hope it is. It's a Friday morning, and all is quiet on the home front. Working in a small DGH, District General Hospital, serving the local community but not a major center or university/teaching hospital, we have 9 ICU bed units. In a rare stroke of luck, we have some stable patients and 2 free beds. I'm doing my routine busy work, taking blood, ordering tests, and arranging transfers out of ICU. In the grand scheme of things is considered easy. A big role of the ICU team is to assess critically ill patients and their suitability for intensive care. Often patients are so ill that ICU does them no benefit and just prolongs the inevitable. With ICU beds a precious commodity, we need to evaluate everyone being cod covered or one so that no one deserving is denied. My senior get a bleep to go see a patient, part and parcel of the job for the ICU bleep holder. Anytime this happens, those in ICU prepare for potential admission. Usually, when a patient is admitted to the ICU, it is an orderly affair. ICU/ward doctors and nurses transfer the patient into the bed space slowly. A concise history is presented to the ICU team of what's wrong with the patient and how we are managing it now. Equipment is detached and reattached so no wires are kinked. Nothing is disconnected and the patient is in the safest possible environment. There is no running or shouting, clear communication is paramount to avoid confusion. Suddenly the ICU doors burst open, and at least 10 staff, an unusually high amount, are wheeling in a young woman on a hospital bed attached with every form of monitoring device available to man. Behind this bed is a trail of blood. If you were to follow this trail, it would lead you out of the ICU, down the corridor of the hospital, across the parking lot, and upstairs of another building into the maternity operating theaters. Note, this hospital corridor was known as one of the longest hospital corridors in the UK, and potentially Europe. Imagine how much blood was lost. Above all the commotion, I make out a few details. A fit, healthy 20-something-year-old lady who was pregnant with her first child delivered the baby an hour ago. She had an epidural for the pain and after delivering felt unwell and dropped her blood pressure. She was also complaining of shortness of breath. At this point, some diagnoses were being considered: too much epidural causing low BP, a known side effect? A deep vein thrombosis causing a pulmonary embolism? As my obstetric colleagues were figuring out and treating these issues, the lady went into cardiac arrest. Immediately they carried out CPR and managed to resuscitate her and get their heart rate back. My senior was called from ICU to attend maternity at this point. Whilst they were stabilizing her and prepping for transfer to ICU, she went into cardiac arrest again and had now developed profuse bleeding through her vagina. In a desperate situation, my senior had to make the call whether to try and get on top of the situation there and stabilize first, or make the 2-minute dash to ICU with bleeding, arresting the patient in hope of getting help with more equipment and expertise. He chose option B, scoop and run. With 2 porters pushing the bed, nurses carrying monitoring equipment, and my senior doing CPR on a rolling bed, they burst into the ICU, blood trail and all. This is where it all becomes a blur to me. I remember doing cycles of CPR, clambering atop this poor woman, trying to push directly down onto the heart, swapping out with porters and nurses when we each became too tired to do effective CPR. Good CPR is backbreaking work. It was further complicated by the need to do CPR whilst a colleague tried to intubate this poor woman because she wasn't breathing on her own. Imagine trying to insert a straw into the slightly larger straw, one-handed, blindfolded, and guys shaking the target nonstop. I remember running like a madman down one end of this hellishly long corridor, from ICU to the blood bank, grabbing every bag of blood, platelets, and FFP I could carry. I remember being told to bleep the hematology consultant, mumbling something about the hematological emergency to request Buriplex and recombinant factor 7. This was stuff I was legally allowed to prescribe, but ashamedly I had no idea WTF it was back then. Advanced stuff they didn't teach in medical school. By now we'd assembled a small army of professionals, 3 ICU consultants, 2 obstetric consultants, one of whom had his fist up the lady's vagina trying to stem the bleeding, a hematology consultant, swathes of ICU and operating theater nurses, and half the hospital's portering staff to retrieve supplies and equipment. And an innumerable no of junior doctors, including myself. I remember rotating back to CPR duty, and by now the poor woman's chest was mulch. They say good CPR almost always results in a few broken ribs. Sadly for us, this lady's chest had been pounded so hard from CPR that you could have flattened her thorax with a bag of sugar from the grocery store. I was now pushing on a bag of organs. Her bleeding was now so bad that there was blood coming out of every orifice. The drip lines giving her fluids and medications were oozing blood. The ports attached to measure BP were bleeding. She was hemorrhaging blood faster than we could replace it in both arms. There was a pool of blood down by her vagina as she bled out from there, despite the consultant obstetrician's forearm lodged up there trying to compress the uterus. There was blood coming out of her lungs and up the breathing tube at the end of every chest compression. In the end, I had lost track of time and space. I was in a daze of chest compressions, squeezing bags of fluid and blood, desperately trying to pump something back into her veins. I'm not sure whether it was 2 or 3 hours into this ordeal when someone senior took the sensible decision to stop the torture and pronounce the woman dead. By the time everyone had left, she was a wreck. A body beat beyond recognition. Blood seeps from her mouth and nose. Bleeding at every site where we had tried to give her medicines and fluids and drugs. So much blood pooled between her legs that it wouldn't make it past the censors of a horror movie. Sheets stained deep red with blood, so much had accumulated and for so long that it was more clots than liquid. My seniors had to then sit the family and husband down and try to explain why a fit, healthy woman in her 20s who had delivered a healthy baby was dead a mere 4 hours later. I am mildly grateful that I wasn't present during that talk, as I had completely broken down after that ordeal, physically, mentally, and emotionally. I volunteered to help the nurse clean this lady up. I was in a trance. Removing all our monitors and devices. Removing all the cannulas and IVs and the breathing tube. Remove the blood-drenched sheets. Wiping her down with warm water and gauze, trying to remove all the blood on her. She was still oozing from the holes where the IVs were. Doing everything to try and make her look the least shocking for when the family would come and see her one last time. The worst was not even the bloody tragedy that she had endured. We learned during the family discussion that she had recently married, and the relationship was not going well. She was desperate for a baby and the husband relented, thinking that maybe a child would pull them closer together. I hate to think that he lost his wife and also ended up with a baby he didn't want. Mostly don't even remember what happened the rest of the day. She came into the ICU around 10 to 11 a.m. and by 2 to 3 p.m. she was being wheeled to the morgue. I do remember going home and just giving my wife the biggest hug of my life and telling her how much she meant to me. TLDR, life is fragile and sometimes despite all our medical interventions and the best will in the world, terrible shit happens. When I was in med school overnight in a trauma surgery rotation, I saw a drunk guy brought in after going the wrong way on a one-way street. He was on a moped and a semi was going the right way. The flesh on his leg was almost entirely detached from his bones from shin to thigh, and he was still drunk and writhing in pain, so that whenever he inadvertently bent his knee, all the flesh just sloughed off and this skeleton leg would be bent, with everything else heaped to the sides. We had to keep his leg held down and straight long enough to wrap up all of it so that it all stayed together, then shot him to the orthopedic or to remove the leg. Imagine waking up from a drunk bender to that. I decided to watch the case and they had me help prep him with antiseptic goop. He was unconscious by now. I vividly recall holding his leg up to try to get the underside of it covered with antiseptic and grabbing his foot to do so, but his ankle was just so internally destroyed that the floppy joint ignored what it was supposed to do and the toes of the foot bent back to touch the shin. Kinda surreal. Not me, but my grandmother used to work at the ER back in the 60s. She saw some horrible stuff, but the worst she's told me about was about a car mechanic. This was back when, instead of lifting the car toward the bottom of it, you just parked it over a hole in the ground. He'd been welding when the gas tube floated. Since he's in a small hole with no place for the flames to go, they completely engulf him instead. The only reason for them bringing him to the ER was to have a doctor legally pronounce him dead. My grandmother saw his remains. He had been crouching down, shielding his face with his arms when it exploded. She could see his watch, it had melted into his flesh. Otherwise, it was all just like a coal statue of a man. Prompted by reading this kind of thread in the past, I asked some of my doctor friends what their worst experiences were. A lot of them used fancy language that I wouldn't be able to repeat here, but the one that stuck with me was pretty hilarious. Apparently morbid patients aren't able to bathe themselves well, so they'll often stink. Some of them go through the trouble of spraying themselves with something, like body spray or Febreze, but boo Febreze, the stench is still pretty foul. Well, there was one patient that was just, it was bad. After hearing about abscesses and such, I was preparing for that. Instead, my friend told me it was something else. This woman had a rotten ham sandwich underneath one of her flab folds. Who knows how long it had been sitting there. South Africa, at the Baragwanath Hospital ER, a lady was brought in who fell, feet first, into a meat grinder at the factory she was working in. Luckily for her, the machine stopped around 3/4 way up her thigh, from congestion, and there was someone trained in first aid on site who was able to tie some spare overalls just above the wound to stop further bleeding. The poor guy also brought all of the mixture of chopped beef and what was left of her lower limbs, also resembling chopped beef, in a bucket. Sadly, the surgeons were unable to reattach the spaghetti limb. She survived and as far as I know is doing just fine aside from the disability. My friend's mom is a paramedic and she told me a story that will make sure I never get in a car with anyone slightly intoxicated. I won't go on long. Basically, a girl was driving slightly over the limit, crashed, and during the crash her head got turned 180 degrees around, but she was still alive, and still conscious. My friend's mom said the girl was in the highest state of panic she has ever seen a patient. Nothing would calm her down, and they couldn't safely inject any drugs in the ambulance because she kept thrashing around and screaming. Blood was everywhere in the ambulance. She didn't pass out. Just kept thrashing and screaming. My friend's mom theorizes that she was blinded or rendered deaf, but aware of what had happened to her. She was DOA to the hospital, and my friend's mom had to take a few days off to recuperate. Don't drive drunk. Don't let anyone drive drunk. Trigger warning, stillbirth. Didn't mean to upset anyone with this post. Just finally felt like discussing it for the first time. Probably too late, but maybe a good thing. I'm not a doctor, yeah, I know, but I am a health professional of another nature. One day a lady attends her prenatal appointment, at term, and halfway through states that she hasn't felt the baby move in a while, and asks if that is normal. She was very vague with how long it had been though. The attending health professional went to check the fetal heart but could not find one. This is where I come in. The HP rings me and states that she can't find an FH and asks me to notify the on-call obstetrician and get a room ready. I say sure, and ask how long she hadn't been feeling movements. I still remember the HP's pause before saying 1 week. At that stage, my heart dropped as I knew there would be no FH found. So I prepare an assessment room, notify the drive, and assist the other HP with the diagnosis through the scan. The baby had passed. I wasn't in the room when she was told, although by this stage they pretty much knew, which I was very thankful for. Little did I know that I would be even more involved the next day. The next day they chose to induce labor. The lady was just getting into active labor and I was chosen to assist the other HP. I never knew how fitting the word stillbirth was till I attended one. It's just so quiet. Still. No FH monitoring, no laughing. Just hushed conversations and gentle encouragement. The actual birth was heartbreaking. Instead of excited "come on, you're doing great's" promising a happy ending. There were just false words of encouragement. The baby.
Oh, the baby.
I feel so terrible describing this baby as gruesome. 1 week earlier this was a little person with a whole future ahead of it, but now it was just a body. A body that had been kept at room temperature for a week while it started to deteriorate. It was macerated, and the skin was peeling and soft. Any harsh handling would rip layers off. And mottled. Pale, yet deep red and purple at the same time. The lips, the darkest shade of purple I have seen against snowflake white checks. That wasn't the worst of it though. The worst was the tendons, muscles, and ligaments, what help hold us together, were gone. This is from a doctor I used to work with. A patient came to the ED during peak hours complaining of vaginal pain. The doc gets to her and goes through the normal routine, gets the history etc., and then pops her gown off and there it is. Loops of bowel coming out of this woman's vagina. He immediately calls the on-call OB and tells her about it. She, unfortunately, thinks he's exaggerating and tells him that it's probably just a prolapsed uterus, which can happen after multiple pregnancies, and that she will be there soon. A couple of hours and several phone calls later, she shows up and takes a gander at this lady, and without even batting an eye, she says, "Can we get this woman to an OR? She's got loops of bowel coming out of her vagina." Turns out this woman had several pregnancies and later had a hysterectomy. That morning she coughed or sneezed and everything just squeezed out. I am sure I am too late for this, but here it goes. You want it gruesome? I am an RN that works in palliative care at the local hospital. Palliative care is where we take care of patients that have a DNR status and are made CMO, comfort measures only. I have seen a lot of gruesome things while working here. We will start with my top one. We had a very obese lady that had bariatric surgery about a week prior. Bariatric surgery is a way to basically shrink the stomach so you lose weight. There are different methods, but this lady had her small bowels rerouted to a newly made stomach pouch. Now keep in mind that this new stomach only holds about 30 milliliters of fluid at a time. If you try to drink more than that you can produce a dumping syndrome. This is where the liquid just bypasses everything very quickly, is not absorbed, and is passed out of the patient. This alone can make a patient very sick. So it is recommended to take very small sips of liquids daily for some time and then work your way up to soft foods, etc. This lady, about a week after her surgery, had her husband sneak McDonald's into her at the hospital. We did not notice. Unfortunately, we do not have the staffing to supervise all the patients all the time, especially ones who know what the hell is going on and are with it, medical term, P. Now, remember when I said about the stomach being able to only handle approx 30 cc at a time of liquid? This lady, knowing the risks BC, not only does she undergo counseling before the surgery, but she also has nurses, LPNs, and nurses' aides. That constantly remind her not to overdo it during meals, proceeds to eat not one, but 2 Big Macs and a large fry and wash it down with a large Coke. The lady was unable to tell us what she ate BC her stomach exploded. The husband told us what had happened. She was rushed back to the ER and the doctor did what he could, but unfortunately, it was not enough to save her. Being wheeled up from surgery, she went straight into palliative care, me being her nurse. She was heavily sedated and never fully woke back up. The stench from her open stomach wound was horrid. Think of walking into the shitter when someone with a bad case of the runs has just left, then add the smell of rotting garbage on top of that. I am not done. Now take that smell and add sweet wetness to it. This is what the wound, her room, and most of the nurse's station smelled like. On her stomach was a dressing. It was to be white, but from the seepage, it was green/brown. The tape was to be holding it down, but again, that heavy wet smelling seepage was spread all over her stomach and was oozing out through the gauze, making the dressing loose. Being my patient, guess whose job it was to change the dressing? Ding ding, correct for 1 point. It was me. I put on a gown, gloves, and mask. BC, God only knew WTF I was going to get into. Upon lifting the dressing, I was face to face with an open midline incision. Midline incision equals open from stem to stern, her whole abdomen just sliced open, leaving everything open to the air. Whatever the hell I was looking at was just covered in this dark green slime. I do not use the term slime loosely. Having washcloths and towels to clean this up was not cutting it. Every time I put any type of pressure on her abdomen, more green slime would inevitably push its way out. Picture the river of slime under the city of New York in Ghostbusters, only with smell-o-vision. It was dripping off of the bed, onto the floor, splattering onto my shoes, but I persisted. Finally getting cleaned up what I could, got the wound redressed, and knowing that I was going to have to reinforce it a couple more times during my shift with more gauze and padding. For those who work in the healthcare field, know this was not a sterile procedure because the doctor had given her, at the most, 24 hours to live. I would go back in periodically during my shift to check on her, do mouth care, keeping the patient's mouth moist and clean, suctioning her for a large amount of that now infamous green slime. About an hour before the end of my shift, now keep in mind that the entire time this woman has been sedated on massive amounts of painkillers and other meds to keep her out of pain and from waking up, I walked back into her room knowing I was going to have to suction her again and even possibly tear the dressing down and redress it. BC, how much drainage there was. The patient was deceased. I could tell BC during her apparent death throes they had somehow managed to turn herself on her side with her one arm draped over the bed rail. Her gown hid the open wound on her abdomen, but it was soaked. Her bandage had fallen off and was laying on the floor in a puddle of green slime. Also in that puddle was, I shit you not, most of her intestines and other various pieces of her. We had to do postmortem care, and yes, again, it being night shift, we have no aides to help. I get the job of cleaning this up. The first thing I have to do is heft this lady onto her back, not an easy task. She weighed above 500 pounds. I then had to pick up her intestines and place them back in her body. The smell was at its peak. I do not know how I am not retching at this point. I know I have a strong stomach for smells and gore, but this is unbelievable. I again clean her up, redress the wound, and can finally call in the cleaning service and then her family. And that is my most gruesome story, although I have others. TL, Dr. Lady ate too much after stomach surgery, exploded her stomach, died. I had to play Tetris with her innards and get her presentable for her family.